Good afternoon, Young Adult Services and Supports Learning Community. We're delighted to have all of you here. We had over 300 people register for this webinar, so we are excited and appreciate your giving us part of your day. I am Gwen White, and I'm one of the co-facilitators of the Young Adult Services and Supports Learning Community. I am at the University of Maryland, but right now I am sitting in Pittsburgh, Pennsylvania, where I live and work from. And I am joined by Johanna Bergen, who is also one of our co-facilitators. Mia, do you want to advance the slide? This is hosted by the National TA Network and is coordinated through the University of Maryland. Thank you, Nia. We can go on. We are very privileged today to have one of our learning community members, Nia Westby, who has presented for us before in webinars, and it's always a privilege to hear from Nia, who is, as I said, a significant part of our learning community. Johanna, before I turn it over to Nia, would you like to introduce yourself?
Yeah, thank you, Gwen, and Nia, thanks so much for joining us. Hello, everyone. I'm Johanna Bergen, the Executive Director of Youth Move National, and as Gwen mentioned, a co-lead in this learning community. I'm really excited that we get to bring content to you all today that focuses once again on the importance of youth engagement and youth voice in all of the work that we do. So welcome.
And Nia, please take it away and introduce yourself.
Thanks, Gwen and Joanna. How is everybody? I am so glad that all of you are taking some time out to talk today about authentic youth engagement. I'm going to touch on sort of the plan for the webinar today. I'm going to say something that people don't always say during webinars, which is you probably want to have either your cell phone handy, or if you're sitting at your computer desk, then you can be ready to click on a link that's going to show up in the chat box, because we're going to do a couple of polls to give you all the opportunity to have some input, try and keep this a little bit more interactive. So I'll give those instructions when we get to the first one of those polls in a minute, but just to make sure, either have your phone handy or be ready to click on a link that Tiara is going to put in the chat box for us. So as we said, I am Nia Westby. I work at the Center for Law and Social Policy, or CLASP, which is in Washington, D.C. I'll say a little bit more about that in a minute. But today we want to do a few things. We're going to go over the policy and systems change framework for transition-age youth mental health and wellness that some of you may have joined a webinar that I did with the learning community back in June, or listened back to the recording, where we sort of talked about that full framework. But today we're going to focus in on just a piece of it, and we'll get to that in a minute. Then we're going to talk about the youth engagement continuum and Heart's Youth Engagement Ladder. I'm going to share some examples of youth engagement in policy and systems change work at different points on that continuum, or different rungs on the ladder. And then we'll have a little bit of time at the end to think about how you can move your organization up the engagement ladder to achieve lasting system transformation. So this is me. I believe you can also see me on camera at this point. As I mentioned, I am with the Center for Law and Social Policy in Washington, D.C. I'm a senior policy analyst on the youth team here. CLASP is a 50-year-old, a little bit more than 50-year-old now, anti-poverty advocacy organization in Washington, D.C. And we are going to go now to the first of those polls that I've mentioned. I've seen people shouting out their states and places that they're calling in from, or that they're dialing in from, in the chat box, which is awesome. Now we're going to get to do a little visualization of that, which will help us practice with these polls. So again, Tiara is putting the link in the chat box. For this one, you can't text. You have to use the link. You can also go to the link that's at the top of this page, polev.com/NiaWestBay309. And when you click on that link, you'll be able to actually click where you're from or enter where you're from, and then we'll start to get on a map all the places that that folks are from. I saw Puerto Rico come up in the chat. I apologize, we don't have the territories on here. But for other folks, if you are in any of the 50 states, please let us know. I see a couple of people have already popped up. I see Minnesota and Virginia represented already. And if you are not in any of the 50 states, you're in one of the territories or somewhere else, please do feel free to put that in the chat box so we know where folks are from. I see my home state of Connecticut coming through.
Tiara or Nia, we have someone says the link isn't working, but then someone else just sent it. Try the one that we just put in the chat box.
There we go. Yeah, they're definitely working for some people.
Yeah.
We got Michigan, Washington, oh wow, Mississippi, Tennessee, Texas, Pennsylvania, wow, Alaska even. We've got folks from just about everywhere. That's awesome. And if the link is not working, it just came up that the poll is full. It does fill up quickly. We have a ton of people on this call, which is super exciting. So everybody may not get to respond to everything. But please do continue to try, and we'll get as many responses in as we can. So now that we've seen a little bit about where folks are calling from, now we're going to take a minute to think about what people want to get out of today's webinar. And for this poll and the others that we're doing, you can either text or you can use the link. So Tiara, again, use the same link that's in the chat box, and you can type your response to this question. What are you hoping to get out of today's webinar? Or if you want to use your cell phone, you can text Nia Westbay 309 to 22333, which will let you join the poll. And then type in your answer to the question, what are you hoping to get out of today's webinar? And as people's responses come in, they'll start to populate on this screen. There we go. Now they're starting to come through.
Yay. Yep.
And the way this works is that the more people are using a word, the bigger it gets. So we have the word used is coming through really strongly, improvements, engagement, ideas, examples. Awesome. So it looks like a lot of people are looking to learn more about how they can think about youth engagement in their work, and then what are some concrete examples that they can use to sort of guide them and help them think about this moving forward. Awesome. Thank you all for the polls. Don't put your phones too far away or put your links too far away, because we will come back to this throughout the presentation. But this is a great word cloud. Awesome.
It is.
All right. We're going to go to the next one. So as I mentioned, CLASP is a national nonpartisan nonprofit organization that works on anti-poverty policy. We've been around for 50 years. We have 6 main policy teams. We have one that focuses on higher education and workforce development, one that focuses on child care and early education, one that's focused on job quality, which is issues like paid family leave, fair scheduling, that sort of thing. We have a team that's focused on income and work supports, which does work around a lot of the different public benefits that people might need. We have a team that, our newest team is focused on immigration policy and immigrant families. And then there's the youth team, which is where I sit. The youth team at CLASP is pretty unique because we're the only ones that are focused on a population as opposed to a policy area. So we really do work across a range of issues that impact young people's lives. And one of the main areas that we've been working over the last few years has been young adult mental health. But what one of the other awesome things is about being on the youth team is that we've really tried to think for the last few years about how we can bring young people's voices and perspectives and leadership and engagement to national policy conversations. Because unfortunately, we find that so much of policy is made and policy that affects young people is made without taking into account their perspectives, their feedback, their leadership, their ideas. So we're going to spend today's webinar talking a little bit about some of that and about some examples that we've learned about from around the country. So this is that review that I mentioned from back in June. This is the full framework that we use to think about our youth and young adult mental health work. And we've really been thinking for the last couple of years about how we move the way that we serve young people from a model that is focused on services where some of the different things that are really effective for supporting young people's mental health are covered and available to different degrees under Medicaid, to a space where all of the pieces, the clinical treatment, physical behavioral health integration, social determinants of health, prevention, and a focus on wellness are all fitting into the puzzle. And we're really thinking about what are sort of the pillars or the key pieces that can support the move from having those pieces kind of outside the puzzle to the pieces that are inside the puzzle. So we talk about 4 key pillars: effective adult-child system partnership, effective cross-sector partnership, racial equity and cultural relevance, and authentic youth engagement. And as I've already suggested, today we're going to focus in on that authentic youth engagement piece. So the first thing I wanted to share with you all is this is a tool that we have found really useful to help us think about how we are engaging young people. There's a gentleman who, by the name of Roger Hart, who has put out this ladder. It's a 8-rung ladder that sort of thinks about different ways that people, that organizations can engage young people. And so the first rung is manipulation, which is essentially young people are told what to do or maybe pressured into saying particular things. The second rung is decoration. And I think we've probably all been to events like this where the young people are there for show, but there's no actual input happening, right? So sometimes, they might be in the room, they might be present, but nobody's actually asking for their input. And then the third rung, which we hear a lot of conversations about, I think, in our space, is tokenization, or where young people are tokenized, where we're asking young people to speak or to share their story, maybe even to give advice, but then we don't take it. We just do what we're going to do anyway, right? We also sometimes run into issues in the tokenism space where you have one young person that's asked to speak for all young people, or we're not being really attentive to the power dynamics of what it's like to be a single young person in a room full of adults trying to give feedback. And the thing I would flag about these first 3 rungs that I talked about is that Hart considers these to all be forms of non-participation. So there might be young people in the room, they might be around, you might even be asking them to speak, but those 3 rungs don't really constitute authentic youth engagement. So then we get into the area where we actually are authentically engaging young people. The 4th rung is where young people are assigned and informed. So that's where young people are chosen to lead efforts developed by adults, and they're just sort of told what to do, and what the adults want them to do. The 5th rung is consultant and informed. So that's where you're going to get input from young people and then have some kind of feedback loop where they're giving their input and then you are circling back with them to talk about maybe how you've implemented that feedback. The next rung is adult-initiated shared decisions with young people. So this is where the work is maybe adult-driven, but young people can influence and participate in the decision-making process. The 7th rung is young people lead and initiate action. So this is where young people's ideas are out front. This is more of a youth-driven process. They have leadership and really drive the action of the work. And in the 8th rung, young people and adults share decision-making. This is where you have true equal partnership between youth and adults, and you're co-creating solutions and managing the implementation process together. So that was a lot of information, and we're going to really spend the rest of the presentation honing in on the different rungs on this ladder, particularly the ones where we want to be, as opposed to the non-participation ones where we don't want to be. But we have another poll question just to get a sense of where we're starting. So same link or same text line. For this question, we want to hear, where on this continuum does your system typically engage young people around system reform and policy change? Because the other thing I'll note is sometimes people are really good at this stuff as far as programmatic pieces, but then maybe not so good on the policy and system side. So would love to sort of get a sense of the range of where folks are in the room on this. And the answers are starting to come in. We definitely have a contingent that doesn't engage young people. But quite a few people around rung 3, 4, and 5. Oh, somebody just came in on rung 6, and somebody on rung 7, not bad. But definitely most of us, it looks like, are on sort of rung 4 and below, which is pretty much what I was expecting. So we're really going to spend our time for the rest of the presentation then on rungs 5 through 8 to maybe start to get some thinking going and some ideas about how folks can move to some of those higher rungs. Thanks, everybody, for your answers. Okay, so we're going to kick it off with rung 5, which is consulted and informed. We're actually going to spend a good chunk of our time here for a couple of reasons. First of all, this is probably where I've spent most of my time since I've been at CLASP. I've done quite a bit of work that's sort of in this consulted and informed space. It's also an example. I'm also going to sort of give you some of the details of the findings that came out of a report that we did that was kind of on this rung to give an example of the types of rich information that you can get when you young people are consulted and informed about your work. And at the very least, this seems like a place that most of our organizations can probably get to. So that's why we're going to spend a lot of time here. But we're also going to give examples on the rungs 6, 7, and 8 that I've learned about in different parts of the country. So the part that I'm going to share with you from rung 5 is resulted in a report that came out last year here at CLASP called the Honda Asterisk. We will be sure to share with you all in follow-up resources the link to that report in case you want to read the whole thing because we can't talk about the whole thing today. But this report is focused on some work that we did with young people who were from small or hard-to-reach communities, which are not really known. So that's why we led in with this quote from one of our participants who was an Asian American, Native Hawaiian, Pacific Islander young adult, because these are communities that we don't hear from. A lot of times when we have national data samples, those groups are either too small or not represented at all in that data, and so there's no information reported. And by engaging with young people on this consulted and informed rung, that really gave us an opportunity to bring to light some experiences that often aren't touched on in national data. So as I mentioned, we were looking at small communities, those whose numbers are too small and nationally representative data samples to be considered reliable and therefore often go unreported, and hard to reach communities, which are those that are likely to be undercounted by conventional sampling methods. So young people experiencing homelessness, young people living in rural communities, those are some of the groups that are likely to be, they're considered hard to reach. The overall report has 5 main sections. We had done some earlier work with African American young people where we'd had discussions with them around mental health, and that was, we refer to that report as go-throughs. So there were actually some things that those young people and these groups of young people had in common. So that's the first section. But then there were also unique perspectives that these young people shared that we didn't hear from African American participants. We talked with them about health insurance, about what mental health means to them, and then close out with policy implications and recommendations. For right now, I'm just going to focus on 3 parts for time, but again, we'll share out the full report so that folks can read that if they're interested. And we talked to 26 young people, ages 16 and 25, across 5 different focus groups. We were in a predominantly white rural community. We did 2 focus groups with AA and HPR participants. We talked to Native young people living in an urban area, as well as a racially diverse group of young people experiencing homelessness that included Latino, white, and African American participants. And there were some people across a number of the groups who self-identified as LGBTQ+. We had 8 young women and 18 young men, and we worked in partnership with a number of different organizations to recruit our participants. So I would say this is one of the first things that I would flag in terms of ways to sort of enter into this work, is to really think about who are the organizations in your community or in your state that already have strong relationships with young people that you can partner with to begin to engage young people around the issues that you want to chat with them about. So we'll share a couple of things from the go-through section of the report where we have, again, a quote from a young person. People relate to what you go through. And it was really interesting that young people in these groups use the exact same language as our African-American participants used. So one of the issues that came up that was consistent was trauma. And we heard about a few different types of trauma. Financial strain, so the trauma that comes from being poor and from not having enough resources to meet your basic needs. We heard a lot about exposure to violence, and we also heard about the trauma that is caused by racism and discrimination. We also heard quite a bit from young people about substance use and abuse in their communities, as well as what supports in terms of mental health they found to be effective and ineffective. So I'm next going to share a few of the quotes from young people that we heard in different communities to, again, show we really like to, when we're doing this work, let young people's words lead us and sort of shine through. So I'm going to share a couple of quotes that sort of demonstrate a few of these points. So in terms of financial strain, this is a quote from a young person who was in a rural area who said, "One thing is that I get to witness a community that's depressingly in decline because we're from an area that's known for coal and nothing else but coal. And since the coal mining industry is dying out, I get to be part of a group that is trying to improve the living standards while we're losing our one source of income." And so this quote really just sort of speaks to the way that this particular community and many communities in our country, particularly in rural areas, are experiencing decline and the sort of the toll that that takes on young people in those communities in terms of access to opportunity. We also heard quite a bit about exposure to violence. This quote came from a Native young adult who's living in an urban area, who said, "Murder rate go up, murder rate go down, but like I said, but there's always killing." And this was a really pervasive theme across groups of young people. When you ask them what are the things that are impacting their mental health, the prevalence of violence in their communities was really a major issue across a broad swath of young people. And then this was a quote about racism and discrimination that we heard from a Asian American, Native Hawaiian, Pacific Islander young person who said, "I'm Micronesian, so like I know we're not really known up in the mainland, but we're kind of known here. We're known for like the newcomers, like fresh off the boat, FOB, stupid, ground, dangerous, and so on. When like I tell people I'm Micronesian, they're kind of scared because I don't look Micronesian. At least that's what they say. And when I do tell them what I am, they hesitate around me. So I'm kind of like lonely in school. All my classes, because like I'm the only Micronesian in my class, mostly all Filipinos, Asians, and other races. They kind of like cast me off." And we thought that this was a particularly powerful quote because a lot of times this is a group of young people that we don't hear from, right? Like who knows who the Micronesians are. But the experience that this young person was talking about, again, had clear tie-ins with the experiences of racism and discrimination that other communities encounter, and really sort of spoke to the way in which the pervasiveness of racism and discrimination in our country are shaping young people and are shaping their experiences dramatically right now. I also mentioned the substance use and abuse piece, which has been a lot of conversation lately, but young people don't necessarily talk about it in the same ways as maybe adults are thinking about it. This quote is from, again, an Asian American, Native Hawaiian, Pacific Islander young person who said, "Struggling with drugs and I did ice. I did a lot of drugs, and I never felt like a normal human being until I came here. I mean, so now it's been 7 months I've been sober, struggling to figure out, like, where is my path, where am I going, everything else." So, and this will show up a little bit later in the policy recommendations, but one of the things that we really took from conversations with young people is that while there's a lot of much needed focus in the country right now on the opioid epidemic, In some parts of the country, that is the drug of choice, and in other parts of the country, it's sort of other drugs that are more prevalent, but that the root causes of addiction and substance use and misuse in communities are really all the same, no matter which drug it is that is being used in that particular community. So we just sort of thought that this was a powerful way to highlight that when we can become hyper-focused on a particular issue, because that's sort of the hot topic of the day, we can really miss the needs of a lot of young people who are maybe having a different experience in their communities. And then the piece about ineffective and effective supports. The young people talked quite a bit about not really caring for medication as a way to manage their mental health needs, not really being in love with one-on-one therapy, and not really thinking that schools were the best place to have their mental health needs met. Again, to be mindful of the population of young people that we're talking to, there were many young people who were not in school, who had left school. But even some of those who were in school were not necessarily having the most positive experiences there. And here's a quote that sort of speaks to that from a rural community. At my school, there were a bunch of intelligent kids like me who would get like straight D's and straight F's because I felt like nobody really cared for them, and nobody at the school really did care for them, because the only people in the school that would really make good grades were the types of people who were like really popular, or like their parent was a teacher, and then they would have like this special privilege around the school, and a lot of people hated them because of the fact that they got so much from teachers noticing them. Again, this was a theme that we heard a lot, right, where there were discrepancies in how different young people were treated within the school by the staff, with real consequences for young people and their mental health. On the flip side, we also heard a few themes from young people in terms of what they find helpful in terms of their mental health supports, what was effective. They talked a lot about the value of peer support, as well as hearing from adults with shared experience. And the quote that we talk about here is really interesting because, again, it focuses on some of the reasons why young people feel more comfortable talking to their peers or talking to people who have sort of a similar background and not wanting to feel judged or not feeling looked down upon or viewed strangely by the people who they're talking to. So this young person said, I was like raised up as like whatever problems you had, just speak it to your family. Because like what you say to them, like for example, what you say to the doctors, they're going to like call CPS or whatever. It's really bad here. They call CPS whatever. So this is a really salient quote in terms of flagging for us as people who work in systems and parts of systems, that sometimes there's a lot of distrust of systems by communities, by young people, by families, because of the history of those systems with those communities, with young people, and with families. So part of the strength that peer support workers and peer support specialists and folks with lived experience that is shared bring to the table is that there is that level of trust that they can establish in a way that maybe sometimes other types of professionals can't. So as I mentioned, there were also some unique conversations that we had in this community, which I'm going to touch on for a little bit. And again, this is exemplified by this quote from a young person in a rural community. It's like, you know, you've been suffering challenges, but you don't know they're challenges until you start talking about them in a different manner. Because, like, for us, it's the stuff that we live through day to day and don't think of them as challenges. We just think of them as the norm. So what were the unique things that we heard in these conversations with young people? We heard a lot about isolation, about suicide, about the role of military and law enforcement in their communities, about historical and cultural trauma, as well as the role of cultural supports in addressing those experiences. So first I'm going to share a quote that talks about isolation. But as long as you mind your business, you're good. So that's mostly what it is now. You know, when you're younger, you always want to be in stuff, minding people's business. Know what I'm saying? But no, you can't mind everybody's business. It'll get you hurt. So it's like, even if you know something, just mind your business. Stay to yourself. Go get your money. Go home. Know what I mean? This was from a native young person in an urban community. And again, this sense of isolation, particularly in these small and hard-to-reach communities, was really strong. And I think young people really thought that keeping to themselves was a coping mechanism, but At the same time, it also ended up causing more harm in terms of making young people feel more isolated and that they didn't have people that they can depend on. And that may be related to why we heard so much about the next topic, which was suicide. I've watched a lot of people commit.
Nia,
oh, sorry, go ahead.
I'm going to interrupt you for just a second because I think this is critical as you talk about this great information. We had a question that they apologize for maybe missing it, but could you explain the go through to?
Yeah. And it's okay if you missed it. I said it pretty quickly. So we have another report that actually came out before this one. It's called Everybody Got Their Go-Throughs, which was, we did that in 2017, which was focused on rural and urban African-American young people, and only rural and urban African-American young people. So we knew that we wanted to, in sort of a next round, talk to a broader group of young people from other parts of the country, from other backgrounds, with other experiences. But what was interesting that we found was that there were some things that were similar between the two groups, as well as there being some things that were different. So we called Go-Throughs 2 that name because it's a reflection of the things that the young people in these groups were also going through that we'd heard African-American young people go through.
Thank you, Nia.
No problem. And I know I've seen little flashes. If there are any other pressing questions, I'm happy to pause.
We have a great conversation going on that we'll get to when we get to question and answer. But I thought the go through to was important to get straight in our heads.
Perfect. Okay. So the next thing we heard a lot about was suicide. We had, this was from a young adult experiencing homelessness who said, I've watched a lot of people commit suicide, and so a lot of times I get scared to get close to people because when they share that stuff, like if they're in one of those moods where they just don't feel like going through the day, like it brings back all those memories because I have a fiance who committed suicide, and I was the one that found her body. So we know, I think all of us know as people who are interested in youth and young adult mental health, that there's sort of a real issue with suicide, particularly in certain communities and certain subgroups. And that was reflected in our conversations with young people. We encountered quite a few people who knew someone who had committed suicide, either in their community, in their school, in their friend group. And the supports that young people felt like they needed to deal with that and to cope with that and to address the feelings around that were not really there, or were not really there in the ways that they felt they should be. I mentioned military and law enforcement as something that was fairly unique in these communities, and with both of these groups, it was both with a positive lens and a negative lens. So I'm going to share a quote that's sort of from the negative perspective, which again came from an urban Native young person, who said, you can't really post on social media because the police follow that too. So with that being said, you make a post on social media and tag people in it. The police watching, so now they know what time you're coming. They're going to be there waiting. There's too much going on. It's not like they're not trying to find all these goddamn murderers that's killing off people's kids. And this quote was in the context of a young person talking about riding dirt bikes as a sort of coping mechanism and a positive way of dealing with feelings that was then criminalized in that particular community. So wanting to sort of have this positive outlet, or at least what the young people perceived as a positive outlet for feelings and be able to, do that, but then have that behavior be watched and monitored by the police. So while in some limited cases we heard from young people about law enforcement sort of having a positive place in the community, on the whole, young people felt that law enforcement was sort of something that compounded mental health issues rather than helping them and rather than addressing them. And I always just flag this as something that, again, you might not necessarily hear in other places or in other ways or without engaging with young people, but that we have to be really thoughtful about how we engage law enforcement in our communities when we're thinking about mental health issues because of sort of young people's experiences and perceptions with law enforcement, and that maybe not necessarily being the right person to respond to these things. And then we also heard in these communities about historical and cultural trauma, which has become a big thing. There's a video that one of my colleagues put together that we can also share in the follow-up resources that talks more about this. But this is a quote, again, from a AA and HPI young person who said, and immediately thought about like how like the Japanese and the Americans came over to Chuuk, Micronesia and had a war, and how like a lot of Americans died, a lot of Japanese died, but they forgot about how much of our people died, all the bystanders. How like my grandma told me this one story about like how her cousin was kicked out of, like her cousins and her people were kicked out of the island so they could use the island for like a military use, a base. So that kind of triggered me. So this piece, and again, it wasn't the only quote like this, was a young person talking about a lot of events that were around World War II, but then talking about how things that happened now 60, almost 70 years ago, still having a very real and felt impact in this young person's life and in his mental health today. And particularly for these small and hard-to-reach communities, this was something that we heard a lot. Historical events, historical trauma, things that happened collectively to communities in the past, having a real powerful impact on young people in their lives today, in their mental health, in their development, in their lived experience. So this is another, like I said, we'll share the resource afterwards with the video that talks a little bit more about this, but this has been something that my colleagues and I have been really paying a lot of attention to in the wake of these conversations, because again, it's not something that folks necessarily expect to hear or assume that young people are impacted in these ways by history, but it was a really important piece of what we heard in these conversations. And then related to that, we also heard a lot about the importance of cultural supports in supporting young people's mental health, and that was in the form of the arts, in cultural ceremonies, as well as youth culture. And so the quote I'm going to share is about youth culture from a young person in a rural community. For me, it's access to the internet and the freedom of information that happens because of that, which is why I would say I understand why I'm so different than the people around me in like terms to define what exactly I am. And it's led me to have a bunch of great friends and people I truly care about that lives in many different places of the world and have different struggles locally to where they are, but also realize that on a national level, we struggle with a lot of the same things. So again, user tip, if you will, in terms of thinking about youth and young adult engagement. Sometimes some of us more seasoned professionals, shall we say, can be down on young people and the social media and their time on the internet and those types of things. But we heard quite a lot from young people about how important a part of youth culture the internet and social media and those types of things are, and how affirming and positive they can actually be for young people's health and mental health. So we really want to make sure that we as the adults are being open to these things and thinking about how we can sort of change our thinking about these types of supports, because they are really meaningful for young people. Like I mentioned, there was some talk as well about health insurance and about what mental health means to young people that we'll talk more about later, or that we'll share more detail about. But I'm going to skip ahead to policy implications that came out of this work, because again, we're here to talk about youth and young adult engagement in systems and policy change. And so I want to show how we took all these things that we heard from young people and then turn that into a set of policy implications and recommendations.
And Nia, you might, Nia,
Mm-hmm.
I'm interrupting again. You might
No
want
worries.
to look at Kat Campbell's comment she just put in the chat box, because I think it may be a nice lead-in to what some of the things you're going to be talking about.
Did you want to share it, Gwen? Because I actually can't see it.
Oh, you can't see it.
Yep.
I see probation often trying to limit access to youth culture because they identify it as a trigger for undesired behavior. And Mariah agrees that this falls into adultism.
Oh, that's interesting. And yes, I 100% agree it falls into adultism. And that, that's exactly the type of thing that I'm talking about, where, again, we have sort of one view of this, these types of things as adults because we didn't grow up with it necessarily, maybe are not as familiar with it, or maybe we're on Facebook and the kids are on Snapchat or, what have you. But yeah, you're actually potentially taking away something that young people really see as a source of support and as a resource and a way to connect with people meaningfully. That again, it might be different for us, but when you take that away from young people, you're really taking away an important resource. And that goes to sort of youth culture broadly in terms, we also heard from young people about video games, about music that they listen to, about sort of different things like that, and how all of those were a key part, they felt, to sustaining and supporting their mental health. So this quote about sort of policy was just sort of an admonition to us from the young people as we're thinking about policy recommendations and sort of higher level change, and about basically that we all need to get together and do the right thing instead of doing shenanigans, is how I would loosely translate. He said, instead of coming together, everybody nice, getting it together and get schools right for kids, stop building all these daggone jails and all this dumb stuff they're spending money on, put it in things they need to be put into. So what did we think, based on all this, the resources needed to be put into? Well, first of all, we flagged, as part of this report, the importance of policymakers considering the unique histories, needs, and experiences of young people from these types of communities in their policy making, particularly as it relates to mental health, but more broadly. And also understanding that these unique experiences, these unique lived experiences that young people from these types of communities have, offer lessons that can help us to have stronger policy making more broadly. And we'll get into some specifics of what we think that means. So one of the recommendations that we made was around addressing the social determinants of health, because young people, again, are talking about the conditions of their neighborhoods, of their communities, their economic condition, all these types of factors, and it's those that they want addressed, as opposed to necessarily wanting more therapists or something like that. The value of cultural healing for historical and cultural trauma, we had already talked about that. The importance of health insurance coverage for young adults, because it is sort of a key access, like it's sort of the first line of access. If you don't at least have health insurance, it's really hard to do anything else. That, yes, school-based mental health services, but we also need some really serious work around school climate and improving school climates so that schools are welcoming environments to a wide range of young people, because if you're putting more services in the schools without addressing the larger school environment, then you're sort of, you're at the same time you're trying to address the problem, the larger systemic issue is still operating and causing more problems. We need much more scale in terms of our suicide prevention efforts, and that we need to make sure that those efforts are informed by the context where young people are. We need to think about a comprehensive approach to substance abuse that is integrated with mental health, and as I mentioned again, not getting hyper-focused on any one substance. And then also thinking about how we can adopt youth-friendly policies in existing programs. One of the examples that we gave is a lot of times we make young people fill out a lot of paperwork when they first show up at our door, which is not really something that they're excited about. Sometimes in workforce programs, for example, they use self-attestation policies. So rather than having to prove everything about who you are and your whole history and all this other stuff on your very first day in the program, you can just sort of sign a statement that you are eligible for this program because you've experienced homelessness or because you have been in jail or that sort of thing. And that's just one example. There are more in the report, but sort of bigger picture takeaways in terms of the conversation that we're having right now. Process. Once we had we went out, we did our focus groups with young people. We had dinner with them. We gave them gift cards to thank them for their time, because it is very important, I think, in all these rungs of these ladders, to think about how you compensate young people for their time and for their expertise. So we always, when we have focus groups with young people, make sure that we provide a meal and that we give young people a gift card to thank them for their time and to thank them for their expertise. But once we had drafted the report and sort of had it almost done, we circulated it back to the partners that we had worked with to do the focus groups to get feedback and input from young people, the young people that we had spoken to. And we got a few pieces of feedback that I'll highlight that actually ended up impacting the way that we ended up publishing the report. So one interesting conversation we had was around the quotes. And Should we edit the way that young people speak to take out likes and ums and curse words and those sort of things? And I ended up having a really interesting conversation with that partner where I sort of said, well, actually, we don't edit the quotes and take that stuff out because we really want to make the point that young people, as they are, as they speak, as they present, should be listened to. And we don't have to clean it up or polish it up or try and change it some kind of way to make it be powerful. That young people's words, as they are, as they come, are meaningful and valuable and should be listened to. And we really want a policymaking audience to learn that. Another piece of feedback that we got from young people was, in one of the reports that we did, was around the photo selection, where young people said, these pictures don't represent us and who we are. And so we had to go back and we had to find some different pictures and work with our designer and change it so that we made sure that those young people felt like they saw themselves in the report. So I think the main point that I want to make as I close this out on rung 5 is that feedback loop is really what makes the difference between rung 4 versus rung 5. We didn't just sort of go have conversations with young people, thank them, and send them on their merry way. We see ourselves as sort of an ongoing relationship and making sure that part of our process before we publish a report, before we share policy recommendations, is to make sure that the young people that we've been talking to are okay with what we're presenting, that we didn't misrepresent them, that it works for them. And most of the time we're okay, we hit it, but sometimes they have feedback and then we take that seriously and make changes accordingly. Gwen, I think I'll take a quick minute to pause before I move on to the next piece. If anybody has questions or comments you think is good to ask now on this piece.
Well, we've had feedback that many people loved the discussion on policy. And I've always said that policy is critical to sustain our better outcomes and change initiatives, so that's good. Jennifer has told us that in Connecticut they're doing a lot around suicide prevention with the school staff when you were talking about comprehensive changing school climate.
Awesome, awesome. All right, well, we'll, like I said, this is the rung where we spent the most time, but I don't want to leave the others out because I do have some pieces to share on rungs 6, 7, and 8. So first, sorry, go ahead, Gwen.
I just said good. I'm
awesome.
excited.
Here we go. Okay, so let's go to rung 6, adult-initiated shared decisions. So this is a situation where this is adult-driven work, but where young people are being included, engaged, and a part of the decision-making process. So the example that I'll share here that is also from my work at class, as I mentioned, we've been doing work on mental health for a few years now, and we built out an advisory board to help inform and guide our work. And you may or may not be able to tell from these pictures, but there are actually a few young people who are part of our mental health advisory board. And we thought that that was really important in a couple of ways. First of all, we wanted to make sure that it was more than one young person, because again, thinking about power dynamics, and we sort of have some very powerful young people in this group, but just being mindful of what the experience can be of being one young person on a board of experts of all sorts from around the country and making sure that we had more than one young person that was a member of the group. Another thing that's really important about the way this group is organized is that the young people who are members of the board are equal experts with any other expert on the board. So what does that mean? That means that they get the same compensation as anybody else on the board, whether they work for the federal government, whether they are a PhD professor at a university, whether they are someone very senior in their career and in their field. The honorarium for work that they do on behalf of Class Mental Health Advisory Board is exactly the same for the young people who have lived experience, who are there to speak from their lived experience and to provide that expertise. And it also means that the young people on the advisory board are contributing in a lot of the same ways as the other advisory board members. They are co-authoring work with us. They co-present at conference with us. They review our work in the same way as other advisory board members and provide feedback, and also help us in our technical assistance efforts and do phone calls and one-on-one conversations with some of our technical assistance partners to share their expertise as young people. So that was this is, again, like I said, a much shorter example because I want to make sure that we get to the discussion. But something else that folks can think about as they are having either boards or advisory boards that are guiding their work, how can you have not one, but a few young people be a part of a larger advisory or governance effort, and making sure that they sort of are on equal footing with the other people who are in that effort. And then we're going to go to rung 7, which is youth-led, youth-initiated. So these are efforts that are youth-driven, youth-determined, based on youth ideas. So as I mentioned, one of the things that's been really exciting in my time at class is that we've been really trying to think intentionally about how we can bring young people and their perspective and leadership and guidance into national policy spaces. Because while it's more common, I would say, at maybe the local level and maybe sometimes at the state level, there are fewer examples of our sort of national policy organization peers that are really thinking very intentionally about this. And so this sometimes causes confusion with the learning community that we're in now, but we call it our YES strategy, Young Adult Engagement Strategy. And that's something that actually one of my younger colleagues really had ownership of here at class, where she's been working on 3 pieces. Our Young Leaders Network, which is really a group of 30 young people from around the country who are already leaders in their own right and doing deep work in their communities on behalf of young people and with young people, and sort of being in regular communication with them to help amplify the issues that they're raising, to engage them in efforts like our advisory board when we need input on different things. That's sort of a ready network that we can tap for that, as well as for a smaller subset of those that we call our policy partners, where we're really sharing technical assistance materials and information with them to support their advocacy work. So they identify the issue, they identify the strategy, but then if they say, we need more information about X federal program, or we need more information about why this law is the way that it is, then we share that information back with them in a way that is digestible for them and for the other young people that they're working with to help inform and strengthen their policy work. And then the third piece that we do is technical assistance, where we, a lot of that is training for young people about who are already leaders, who are thinking about wanting to make system and policy change, and we offer a Policy 101 workshop where we really help young people to build out an advocacy agenda around the topic of their choice and provide sort of the parameters and the framework of what is policy anyway, what is advocacy, what does that mean, and what would that look like for young people in my community. So this is ongoing work that is happening at class that we're really excited about. But so far we've already engaged over 200 young adults in different ways through our YES strategy. We have a strong policy partnership with an organization called Opportunity Youth United. Opportunity Youth are young people who are disconnected from from school and work between 16 and 25. And Opportunity Youth United is an organization that brings together a bunch of those young people from around the country to try and work on policies to better support that population of young people. One of the ways they do that is through community action teams, or CATs, as they call them. And right now those are the cities where they have them: Philadelphia, Baltimore, Los Angeles, Atlanta, and Columbus, Ohio. So if anybody is on the line from those places, we can, you definitely might want to connect with your local CAT because we've done a lot of, again, work with them around organizing around a policy agenda and sort of trying to move work forward that is led by young people. And we've done, as I mentioned, the Policy 101 workshop. For any of you who are going to Orlando for the TA Network Conference, the youth track will include actually the Policy 101 workshop offered by some of my colleagues, so just putting that plug in. We're very excited about that. But so far we have done them in Tennessee, DC, Chicago, and Oakland for a variety of different conferences. So what are the takeaways here? to really think about, okay, maybe we, the adults, don't have to be out front. Maybe there are ways that our systems and our agencies can support youth-led initiatives that are already happening in our community or in our state, and trying to figure out how to connect with those initiatives, those efforts, those movements, because a lot of young people think about their work in terms of movement building, and then figure out how we can offer our support, feedback, information, resources without then having to take over, I think is the key. And then the last round, I'll touch go ahead, Gwen.
I'm just going to interrupt. We have a lot of good conversation going on in the chat box, but things around response to your thing about the environment. And Leslie pointed out if the environment is not welcoming, then young adults, I call it vote with their feet. They're not going to participate no matter how good your programs are. And then the whole issue of trust. And young adults being system weary and system wary, and how do we improve trust?
And appropriately so, right? As I said, and as the person said in the chat box, it's not like young people feel that way for no reason, right? Like they've had experiences with these systems that have put them in our place, in that place. And I think sometimes we as adults can get into this phase of, oh, we keep doing this stuff for them, and why won't they show up? And the young people don't want to come, and they don't want to do this, and they don't want to do that. It's like that's happening for a reason. And you have to really, like, humble yourself and take a minute and be like, okay, let's try and figure out how we can understand why this is happening. So, again, maybe starting at rung 5, working with some partners who already have that trust established with young people. Don't go in there and blow it because they don't want to put their street cred on the line for you but so many times. But, to really be humble and really be in a listening and learning stance, because if given the opportunity, young people will tell you why they're not showing up to your event, or why they're not using different programs, or who was rude to them that made them never want to go in there again, or all those sorts of things. I think the other thing, go ahead, Gwen.
No, you go ahead, and I'll
jump in. The other thing I was going to add, because I'd never heard this term, but it actually came out of a meeting we had with that advisory board recently, where someone talked about procedural justice, and that is the idea of thinking about how you have set up your meeting or gathering to ensure equitable participation, right? And so we as adults, and it's, again, I get it because I'm a mom, I have a family, I'm not trying to work but so many hours in a day, but we don't want to meet outside of work hours. But then young people can't come to your meeting that's at 2 o'clock on a Thursday. Either they're in school, or they're at work, or they're taking care of their own kids, or, what have you. We can't have a meeting at noon and not feed people. We can't have a meeting for young people who are parents and not either accommodate their children or figure out childcare or something. I've had many a focus group with babies crying and with toddlers running around and what have you. But it was more important to me that the parent be there than that it be quiet. And, the company that did our transcriptions probably hates me for it. But it was more important to me that we be able to have that young parent in the room than that we make sure that the recording was nice and quiet for our transcriber. So just things for, again, folks to think about in procedural justice. How do you set up your meetings and gatherings to make sure there's actually a possibility of equitable participation by young people? And then, just being really aware of how relationships with systems have been damaged, and that you have to just keep showing up and keep showing up and keep showing up and keep showing up to show that you're serious and that you're worthy of young people's trust.
And Mariah actually labeled this for us, called it the climate crisis, which is a huge issue. Leslie likes the idea of the consistency and empowerment that you've been talking about. And Michelle reminded us that in the tribal communities, some of the councils have been using a youth council to help with their voice directly into policy.
Oh, that's cool. That's very cool. I would love to learn more about that. So speaking of sharing resources, we'd love to maybe have that, any information that you have about that we share more broadly so we can amplify that. And speaking of, so I have a couple of things on rung 8 that I want to amplify really quickly before we dive into additional questions. So rung 8 was shared decision making, where we have young people and adults really co-creating together and managing implementation and things like that together. So I'm going to share one example that we learned about during a scan that we're doing of policies and practices in different states and localities around the country, which came from New Mexico. And this is just a little bit about New Mexico. I can't remember if New Mexico is on the phone, but it's a state with a very high poverty rate, with a lot of young people of color, with a lot of young people experiencing poverty, but it has really been doing a lot of work to really try and think about how to better serve young people, better meet young people's mental health needs. And one of the things that we learned about there that we thought was really cool was that they built out a model where there's a youth coordinator at the state level who, with some other young people, is responsible for training all of the agency staff. So really flipping this thing on its head. Let young people develop and run training and be responsible for making sure that all of the adults are trained on issues like what is adultism and how can I, not be showing that in my work with young people, and how can I have youth-friendly practice and all those sorts of things. And the people that we talked to really talked about how that had sort of shifted their ability to work effectively with transition-age youth, because they'd taken this step of making sure everybody was trained and making sure that young people were responsible for making sure that everybody was trained. And the other example I'm going to share is from New York City, which is a huge place, a lot of people, a lot of poverty, a lot of young people of color again. But we learned about this through sort of another line of work that I do, focused on young women of color. But there was an initiative a few years ago called the Young Women's Initiative. I shouldn't say a few years ago because it's ongoing, but it started a number of years, probably 5 years ago now, where there was an effort through a collaboration between a nonprofit organization and the city council to engage a large group of young women of color in the city around issues and policies and systems that they would like to see different in the city. So there was a large group of young women that worked over the period of a year and they developed a report that has 100 different policy recommendations across 6 areas: health, economic and workforce development, community support and opportunity, education, and anti-violence and criminal justice. And that what has happened now is that group has continued to engage with the City Council on an ongoing basis, backed by some funding, to work on prioritization and implementation of these recommendations. So they've been really working over the last couple of years now to try and start to implement some of these recommendations that came out of this report. And I just found this yesterday after the PowerPoint was already done, but I can also share this if we'd like, both the document with the recommendations, as well as they develop kind of a how-to guide in terms of engaging young people in this type of initiative that we can share out the link to that afterwards as well. So, big takeaways. Which rung you should be on for which project or which effort or which issue can vary, right? Like I said, I gave 3 examples from class that were on 3 different rungs for sort of 3 different pieces of our work. There may be folks who, because of where you're starting, you can only maybe move a little bit in one area. But what I would say and what I would argue is that in order to truly have systems change and have our systems effectively serving transition-age youth between 16 and 25, we really need to think about how we can move our organizations up the ladder. So if you're starting at tokenism, which we did have a lot of people there, let's see if we can get up to rung 4 or rung 5. If we're starting at nothing, we also have a lot of people there. Let's think about maybe we can skip some of those not-so-hot steps that we talk about and get up to rung 4 or rung 5. If we're already at 5 or 6, let's think about how we can push ourselves to a 7 or an 8, because I know that's what we do in our work. It's a work in progress. There's been a lot of movement in my time here at class, but it's really just critical in terms of us being able to make a difference in the lives of the young people that we want to support. So that is it for the main presentation. I have one more polling question to close us out, but would love to open it for more questions and comments before we go to that.
Nia, William has told us about how he supervises a council of youth in care. I assume child welfare from 16 to 21. And they are compensated for being on panels and work groups to create policy. And they're working on a bill to extend the tuition waiver for their youth in care. This is in Kentucky and funded by the Chafee
awesome.
grant program.
Yeah. In child welfare, there are, and some of them are, again, legally mandated, but there are sort of quite a few sort of in pockets of that kind of thing in child welfare in particular, in some juvenile justice spaces, in some systems of care, and that's awesome that we're able to sort of propose a policy change and are able to do advocacy around that.
And Alan's offering us some resources from the tribal community. So thank you very much, Alan. And if you send those to us, our contact information will be at the end. We will certainly make sure that those are disseminated.
Great. I'm excited to look at those.
Stephanie's looking for documents that suggest steps to recruit youth and prepare youth for this kind of participation. And yes, Stephanie, we do have those, and we will certainly get those out to you.
Nia, this is Johanna. I'd call your attention to a question that came in earlier, sort of at the top of the webinar, as you were talking about engaging young people in that Rung 5 area. And the question was about if you're hearing anything around engaging young people, particularly in care when they come from a family culture where youth voice isn't valued, where there's a elder wisdom that we often adhere to, and if you have found any insight in your work in that area.
Interesting. So I don't think that has come up specifically in any of the conversations that I've had with young people, but I'll say I have a couple of thoughts about that. I think it's really important to have these conversations in spaces where young people are comfortable, and making sure, even though we partner with organizations to set up the focus groups, we try, it doesn't always work, but we try not to have like folks from the program or something like that in the room, just because of how it could shape the conversation. I think I've found that given an opportunity, I've yet to meet the young person who doesn't have something to say when asked. I think there are things in terms of the group size that you're talking to and that sort of thing that can maximize participation and, make sure that quiet people get a chance to speak. We try to keep our groups to no bigger than 8, because I find once you get to 10, there are going to be 2 people that don't talk, and if you have 15, there are going to be 5 people that don't talk, and that sort of thing. But I think there are things that you can do to set up your group to try and maximize participation. And, yeah, I haven't found young people who don't have things to say and don't want to share, no matter what their cultural background. I would say that's a unifying factor, is everybody has something to say. Now, whether that's allowed in their home or whether that is the norm in their home, I think is a different thing. But, there's something about having someone come in and treat you with seriousness and with treating you as an expert. They're really there to provide their expertise. And I've yet to find the young person who really didn't want to take us up on it. Because we always offer it. When we start a group, we're like, hey, you all can roll out anytime that you want, and I haven't had anybody leave. There are other questions coming through. We go to the poll, too, while people continue to ask questions.
Why don't we go to the poll, and then we'll summarize.
So the last one, this is, people had some ideas and some expectations and what they were hoping to get out of today. So although it's hard to believe, we're already almost a month into the new year, but we are still early in the year. So I would love to hear from folks in 2020. I'd like to see my system engage young people around system reform and policy change at what level? And so you can just send your responses A, B, C, D, E if you're texting them from your phone, or you can, again, follow the link and do it online. But this is sometimes it's helpful to put a goal out there to hold ourselves accountable around it. So would love to sort of hear where folks are. And we have a lot of people aiming high. A lot of rungs 6, 7, and 8. Nice. Nothing wrong with rung 5. Like I said, I spent a lot of time there. We'll give folks a couple more minutes for any final responses or questions. And if not, I'll take us towards the end because I see we're almost at our time. This is my contact information. Happy to hear from anyone by follow-up. As I mentioned, we'll pull together resources and get those out to you all. Thank you so much for joining. I really appreciate it. I'm excited that so many people were here and that so many people are excited to think about this kind of work in 2020. And I'm sure that Gwen is going to do this plug, but will have office hours on February 10th. That will be focused on this topic to sort of continue the conversation, share ideas. I've actually invited my colleague who is in charge of our young adult engagement strategy to join that conversation as well. So hope to hear from and see many of you all there. And then I will pass it back to Gwen.
Thank you very much. I actually have the office hour for February 12th. So
I may have lied.
Go
with what Gwen said.
It's February 12th from 2 to 3. It will be informal conversation, follow-up to this. We'll try to get out resources to you before that. You can see here that we organize ourselves around a topic with webinars, office hour, resources, and there's a way to be a part of the learning community. And then on February 25th, we're going to hear from the Florida Healthy Transition grantee, their project director, who has done a lot of things, concrete measures on that would fall on rung 6, 7, and 8 around encouraging young adults to enroll in services and what they've found around that. So put that on your to-do list too, please, on your schedule. That'll be February 25th from 2 to 3 Eastern Time for those of you in Alaska and other places as you want to figure it out on your calendar. Johanna, anything else to add?
Just a note of thanks to Nia and to everyone for the robust conversation in chat. I think we'll be able to add to the resource archive not only in disseminating resources you're requesting from today's webinar, but also populating them into our learning community of ideas at the Institute. So thank you for helping us grow that with your curiosity.
And feel free to be in touch with us as you think of other things that, and if you go into the ideas at the Institute, there's even a conversation tab where you can post questions to the learning community. I think that you will get a survey when this is over. Please feel free to fill that out because the information is very critical to us. Okay, thank you, Nia, and we'll continue the conversation on February 12th. Bye, everyone.
Thank you all. Take care.